APIA Nevada is a grassroots nonprofit organization that advocates for policies empowering everyday Asian Pacific Islander Nevadans. Nevada is home to a growing APIA community, accounting for 1 in 10 voters. We are One APIA Nevada. Concili Incorporated is Nevada's premier Democratic campaign firm, fighting for progressive issues and candidates for over a decade, and proud sponsor of Battle-Born Progress.
This episode of Out in Front brought to you by
Concili Inc., Nevada State Education Association, One APIA Nevada, Silver State Voices, and Stefan and Marta Schmidt, as well as our episode sponsors, Save Lives Nevada and Washoe Education Association.
In Front with Annette. My name is Annette Magnus, and I'm the Executive Director of Battle-Born Progress. So happy to be with you tonight, celebrating the 57th birthday of Medicaid and Medicare, two incredibly important programs that so many Americans and so many Nevadans rely on every single day. And we're also going to be talking about the reconciliation bill that's been moving through Congress. We have some experts and some storytellers who are here tonight to share everything they know about these important topics and more. So thank you for coming back tonight with the to OIF with us. I can't talk today. It's been a long day. So excuse me as I mumble my way through the show tonight, but it's going to be a great program. We're going to talk about some positive things tonight. I want to let our viewers know that next week we are going to be off from OIF. We will return the next week to do a back to school special, but we are going to be out next week in New Mexico at our national retreat, learning all of the new tips and tricks for our Progress Now affiliates. So we will not be live next Thursday with you, but we will be back the following week with a back to school special, and we will remind you at the end of the show. Also, if folks have questions, put them in the chat tonight. We will have lots of links for you and different information for you. But if you have questions for our amazing guests, put them in the chat and we will get to them in just a little bit. So on our show tonight, we have some of our favorite Battle-Born Progress staff, and I want to introduce them first. We have Miss Paula Luna. She is our operations manager. She's here to tell her story tonight. We also have Brenda Rodriguez. I almost said her wrong last name again, and she would have killed me. She is here tonight to talk about her Medicaid story and her journey with that with her son. In addition to that, we also have one of our favorite volunteers, one of our previous honorees at Celebrate Progress and Volunteers of the Year, Steve Horner. He is a retired teacher. He works with NSEA here in the state. He is such an amazing person. So, Steve, I'm excited to have you tonight. And then returning guest, Will Fisher. He's the lobbyist with Lower Drug Prices Now nationally, and we get to work with him on all things healthcare. So, Will, thank you for coming back to the show. So we're going to get right into it tonight. Will, I'm going to start with you. So we're going to actually start with reconciliation, how it ties to the Medicare and Medicaid anniversary, what this reconciliation bill does, why it's important to Nevadans and Americans, and what we should be thinking about as we move into election season as it relates to healthcare, because a lot of these candidates are going to make a huge difference as to whether or not we can get this reconciliation bill done, but also continue moving forward as it relates to prescription drug costs and being able to keep affordable healthcare. So for the folks that may not be up to date, what can you tell us about the reconciliation package and why is it so important for all of these reasons?
Yeah, so I think I'll begin by saying, kind of reminding people that when you hear terms like reconciliation package, this mirrors other terms that you've heard throughout the year, such as Build Back Better, or now what we're calling the Inflation Reduction Act of 2022, which is the titled bill of the Reconciliation Act. And what the Reconciliation Bill is, just a quick overview is it is a fast track process to make it easier to pass legislation in the Senate that falls in line with the rules of the Senate, namely as it associates with the annual budget. So if the Senate determines that they want to use reconciliation to pass legislation, they come up together, the different committees, the Budget Committee, Finance Committee, Public Works, and House, Energy and Natural Resources, everybody. And they all come up with, all right, as it relates to the annual budget, here are the pieces of legislation that we would like to see in reconciliation. Reconciliation requires 50 votes to pass. Everybody determines, all right, here's what we've agreed on. This is what we want the bill text to look like. That then goes before the Senate parliamentarian, where much of the reconciliation package, the Inflation Reduction Act, is presently. The parliamentarian then reviews the text that's been provided to her, make sure that it falls in line with the rules that govern the Senate. In this case, it's called a bird bath. This is named after the late Senator Byrd, to make sure that it is in compliance with those rules. And then from there, she will then give back to the Senate, here is a scrubbed, up to muster text that can move via reconciliation. As the process stands right now, the bill that she has, the leader Schumer is going to bring the Senate back into session on Saturday at noon. This will begin, he will pass a motion to proceed later in the afternoon. This will kick off a required amount of time for debate, and then we will be in what's called vote-a-rama. At the conclusion of that, the Senate then will take a vote, an up or down vote on the reconciliation bill. Assuming it gets 50 votes plus the tiebreaker of Vice President Harris, it will then move to the House, at which time Speaker Pelosi can call House back into session Wednesday, Thursday, Friday of next week, bring them in, they vote, it passes the House, and then it will go to the president's desk for signature. Again, I just want to really stress to the folks watching, reconciliation bill, Inflation Reduction Act of 2022, when we were talking about Build Back Better, those are all different names and different iterations of the same piece of legislation, holistically called reconciliation.
Awesome. Thank you so much. And Will, talk to me about why this is so important in terms of the work that we do, specifically the work that we do around the prescription drug costs and what that can mean potentially for Nevadans, because I know that issue is so critical right now for so many people. So many people cannot afford prescription drugs or healthcare for that matter. Why is this reconciliation bill critical for that?
It's a great question. That it's tremendously important, and it's to everybody, right? And it's one of the most bipartisan across the political spectrum, poll after poll after poll. Everyone says we have to do something about drug pricing reform, and the drug pricing reform provisions within the reconciliation package have broad support from Democrats, Republicans, and independent voters, not just in Nevada, but nationwide. And this is because these are common sense pieces of legislation. When the Medicare Modernization Act passed in 2003, one of the provisions in that bill made it illegal for Medicare to negotiate the price they pay for certain drugs. And keep in mind, Medicare is the largest purchaser of drugs in the world, right? They were illegally forbidden from negotiating the prices that they pay. Other governmental agencies were not. So, for example, I am an enrollee in the VA healthcare system. The VA, on average, pays 54% less for the exact same drug than Medicare does. Why? Because VA has the ability to negotiate the prices that they pay for a drug. So that provision is just critically important in bringing down prices, launch prices, and which are going to absolutely result in savings for folks at the counter. Some of the other provisions that are very, very important to this, it caps Medicare out-of-pocket cost at $2,000 per year. for Medicare Part D enrollees, and that can actually be smoothed out from the payments over the course of a year. So it's not like spend $2,000 in January, hit that cap, I'm done. You're able to break that amount into affordable monthly payments. Also, going back to price, it institutes inflationary penalties for drug corporations who increase the prices of drugs faster than the rate of inflation. And a few other provisions that I think are very, very important to point out is there's one that the Senate Finance Committee, Chairman Wyden put in that very, very important, and that is a rogue secretary loophole. So what this does, it actually requires the Secretary of Health and Human Services to negotiate. So we can't get into a situation where we could have a secretary be like, yeah, I'll negotiate, charge us whatever you want. That's not going to happen because of just the absolutely just commitment to keeping prices down for patients that we've seen throughout this process from people like Chairman Wyden of the Senate Finance Committee, who has been a leader in a lot of this work in the U.S. Senate. And then I think another provision that's so critically important to that is with these kinds of savings, part of that is then going to go to extend for 3 years. We were approaching basically an ACA disaster where under the American Rescue Plan, people, what they were paying in premiums for the Affordable Care Act, they were getting ready to see those rates increase. And what this is going to do is going to extend those current rates for another 3 years. So critically important. And there are other provisions that are also still before the parliamentarian, right? Some of those specifically related to insulin, namely capping the cost of the out-of-pocket cost of insulin at $35 per month. For Medicare, for people in private plans, and it's still getting figured out by the parliamentarian if that's going to be strictly to Medicare or if that will extend to people in private plans as well.
So, Will, just to kind of, cap this off, how has our Nevada delegation been doing on these issues?
Oh, tremendous, right?
Well, some of them. There's one
I can think of one who hasn't been great, right?
His name is Mark Amadei, and he does nothing right usually.
Yeah.
The rest of them have been great in terms of, especially like Senator Cortez Masto and others, they've been great on these issues.
Dividing it up really, like Annette, I think the easiest way to talk about it is like, take your two senators, for example, right? You mentioned Senator Cortez Masto. She's just lights out great. Fun fact, so is Senator Jackie Rosen. They've both just been talking about this nonstop. They talk about it at town halls. I know Senator Cortez Masto had an op-ed published in the Reno paper last month about why this is so important, why this is such a top priority for her, and how it will affect Nevadans. And just your Senate delegation in Nevada, Ms. Rosen, Ms. Cortez Masto, absolutely have been tremendous and have just made this a top priority throughout this entire conversation, going back really to the weeks following President Biden's inauguration. This brings me then to the House. All three of the House members, Democratic members of the Nevada, all three Nevada members of the U.S. House who are Democrats are what we call frontline Democrats. This is sort of a definition wrapped up in electoral politics because it is it's a word to communicate that they are in some of the most competitive seats in the nation. And all three of your Democrats in the congressional delegation have used their platform both as Nevadans, as members of Congress, and as frontliners to communicate how important this issue is to them legislatively, because they recognize how important it is to their constituents. They hear about it at town halls. They hear about it on phone calls and letters into their office. They hear about it when they go to the grocery store. There's no way that Steve Horsford, Dina Titus, or Susie Lee walk 15 feet out of their front doors without somebody coming up and being like, hey, I'm paying way too much for drugs. In fact, I can't even afford them. And I'm forced to make choices like, are we going to eat dinner tonight, or am I going to take medicine tonight? Am I going to get my kids back to school gear, or am I going to take the drugs I need to live. And it didn't take hearing that too many times, because these are just tremendous individuals who have been committed since they have arrived in Congress, pushing for these issues, and they have just been absolutely paramount in seeing us get to where we are right now.
All right. So, Will, before I move on to some of our other speakers and then we come back to you to talk about other things, what do Nevadans need to do? Obviously, most of our delegation is good, minus Mark Amadei. But what do Nevadans need to do to help make sure this gets done? And what are the chances, especially on the prescription drug price negotiations, what are the chances that this gets done now before we get into election season and Congress stops working?
I'll answer in reverse order. This is going to happen. This is going to pass the Senate. This is going to pass the House. This is going to be signed into law by the president. The reason that is happening goes back to the first question you asked. What can people do? And what they can do is keep doing what they have been doing, which are raising the issues, the stories, putting those stories directly in front of your elected officials, pressing for the real impact that these critical decisions have on the lives not only of the people of Nevada, but people throughout this country. And this is a kind of legislation where we say, and this person's going to benefit, and this person in this program is going to benefit. But in reality, when we're doing these types of pieces of legislation, everybody benefits, because you have to remember what Medicare pays for certain things is a driver for what so many other people in other group plans and private plans, what they also pay. So when we're bringing down prices in Medicare, this has an effect of bringing down prices for everybody. So I would continue to amplify stories directly to the members and to their staff. I would continue to make those phone calls, send those emails, attend those town halls. And I would lastly say, and I think we're all guilty of this, is once this is passed through the Senate, once this is passed through the House, once this is signed by the president, that you pick up that phone, you pick up that pen, you plug in that computer, and you say thank you. And I think during the August district work period, which is what we call recess these days, we make a point of making sure that when we were taking those patients into town halls to press them on this issue, we in turn now make sure we're bringing those same folks back to those town halls to say thank you to these elected officials for everything they've done. And I used a word a moment ago that I want to just come back to, and this is critically important, and that's the word staff. And the staffs of the members that I just now mentioned, whether it's Senator Rosen, Cortez Masto, or the staffs of Congressman Horsford, Titus, and Lee, have also been tremendous to work with throughout this process. They return calls, they reply to emails, they're enthusiastic about engaging, not only with me here in Washington, D.C., but I know with the whole crew back in Nevada, and have been a tremendous pleasure to work with. And I never miss an opportunity to, whenever I see these members, to also compliment them on the great work that their staff does day in and day out to get us to where we are right now as well.
And well, I think that's the perfect tie-in to how this relates to Medicare and Medicaid and the anniversary we just had, because it's the expansion of these programs which keeps us moving forward. And it's the expansion of these critical programs that the people on this, show tonight have used, or their family members have used, that are keeping Americans alive, keeping Nevadans alive, and keeping them healthy. And so we have to continue expanding these programs. And we are relying on our Nevada delegation, regardless of party, to do the right thing and vote for this reconciliation bill. One question in the chat, and then we're going to move to Steve. Richard asked where, and I think this is a common question a lot of us have at this point in our lives when dealing with the Senate. Richard asked, where is Kirsten Sinema with this bill? But I also add, where is our dear, dear friend Joe Manchin on this bill? And are they going to come along and do the right thing here?
Yeah, so I have to say, speaking specifically to the drug pricing provisions, the drug pricing provisions that exist in the Inflation Reduction Act, Senator Sinema played a critical role in negotiating those ahead of the House vote in the fall. And pretty much what passed in terms of drug pricing provisions in the House bill in the fall mirror what are in the Inflation Reduction Act. before the parliamentarian and soon before the House and Senate. Senator Sinema was critical in negotiating that package. When it comes to Senator Manchin, this is someone who has long advocated for things like Medicare being able to negotiate drug prices. He often uses his time serving on the Senate VA committee and the experience that he had seeing the successes that the VA had in terms of things like drug price negotiations to talk about why he supports this for programs like Medicare. He's can be rather pithy in his comment sometimes in the hallway. And he's like, look, VA does it and save him a ton of money. Like, I don't know why everybody got to do it. And that's it, right? But he recently did an event back home in West Virginia with AARP and some other advocates, again, talking about his strong support for the drug pricing provisions that exist in the Inflation Reduction Act.
Well, thank the goddess above, because for once in my life, I can say that they are being useful. So that's great.
Yeah.
Well,
and I would
hoping they continue to be useful.
And then I would just say, one of the great things about the drug pricing provisions is really it's been since the fall that this has been one thing that has had the public support of all 50 Democratic members of the Senate and 218 Democrats in the House and more. And it's been really, that hasn't wavered. And going back to what we said a moment ago, that's because people haven't let up in raising the importance of the issue at town halls and other communication with their elected officials.
Awesome. Thank you for that, Will. We'll come back to you in just a few minutes. So I do want to move to my dear friend, Steve Horner. He is activist extraordinaire. He does so much for us here in Nevada. Steve, I want to bring you back in and ask you a question about the care you receive. You are a veteran, but I know you also have a Medicare story. Why is Medicare so important to you, and how has it helped you in your journey with your health? And I think Steve's on mute. So Steve, hang on a second. There we go. We got you.
Okay. All right. Well, first of all, I'm not on VA because I've had such a difficult time going to VA, et cetera. So I depend on Medicare, and my prices are just absolutely horrendous, especially my drug prices. I have a chronic illness with COPD and with heart care. And my big story is I broke my concentrator in White Pine County. As people know, I travel the state of Nevada. And I was on teachers' health care at the time. And as that has deteriorated, so has coverage. And I walked into the emergency room and they said it was going to cost me $1,000 just to walk in. No care yet, etc. And I could not get supplemental oxygen because the Teachers Health Trust was not covered in White Pine County. So now that I am on Medicare, I can walk in. Medicare will pay for the Part A will pay for the emergency room minus the copay, but I mean that's fine. And it will also cover for the supplemental oxygen. And so that's extremely important to me. As was mentioned, I had to go to a separate company, Mutual of Omaha and Humana, for my Part D, because my drug prices were I was going to be paying over $1,100 a month on a retired teacher's salary. And that would mean whether I take my medication or if I take if I eat. So the negotiating of lower prices is necessary. And I have been very active in campaigning and lobbying my senators and my representative, and they're all on board. So Medicare is tremendous. And as long as we have a for-profit medical system in the United States, this is something that is an absolute necessity.
And folks are going to hear me at home, but see Steve, because Steve's on his phone tonight. So we're just going to hang with Steve, but you're going to hear my voice, and I'm going to ask him the next question.
Sorry.
Don't say sorry. You're good. We got this. So Steve, how does Medicare help you with your prescription drug prices? You talked about it a little bit, but dive in a little bit and explain to the viewers how Medicare specifically has helped you with prescription drug prices. And as Will was talking about, why would it be so good for others to be able to get the same type of drug prices that Medicare provides you?
Medicare, and I'm going to be honest at this point in time, because of the donut hole and because of the inability to negotiate for prices, I had to go outside of Medicare because it doesn't do a very good job in getting prescription drugs for people. With this reconciliation bill, and I do agree with Will, I've looked at the numbers, et cetera, this should pass and pass pretty well. And I think that will be tremendous in helping not just Medicare, but for those outside companies like Humana to negotiate lower prices. And my inhalers, instead of $1,500, would go down to $100, and that I can afford on a regular basis.
Absolutely. So how would your life change if there were no longer access to Medicare, which we know is a scary thing to talk about, but could be a real proposition, specifically if people like Adam Laxalt get elected to the United States Senate, which is horrifying to even think about. You know, he doesn't care about healthcare. He doesn't care about Nevadans' health. He doesn't care about me being able to make my own choices about my body. Right. How would that impact you, Steve, if this went away?
Let's be honest, I would probably be dead because I couldn't afford what the medical care. I just couldn't. With pre-existing conditions, having had 2 heart attacks, having COPD, and borderline diabetes, I just could not afford open market healthcare. And we know what happened with the Teachers Health Trust here in Clark County. It is absolutely dissolved. And so I would basically be dependent on whatever welfare, et cetera, could give us as far as Medicare goes. And so, I mean, medical care is an absolute, it should be a right. It shouldn't be a privilege. And without Medicare, it would be a privilege, and only the rich would survive.
So, Steve, with that in mind, what does this Medicare and frankly Medicaid anniversary, it's the 57th anniversary of Medicare and Medicaid in this country. What does it mean to you? And what do you want people to know about the importance of access to medical care and prescription drugs for not just you, but for everyone? Like you said, it should be a right.
Yeah. I remember when President Johnson signed this. That's how old I am. I remember when Johnson signed this in, and I knew even back then how important this was going to be for the American public. I'd seen my grandparents struggle. I'd seen other people's parents and grandparents suffer because they didn't have access to medical care. I also know, being president of NSEAR, the retired teachers, I know that there are teachers that don't qualify for Medicare, and I see what kind of struggle that is. And because we're a WEP GPO state, and so I see firsthand every day what a struggle it is for them to afford medical care, and that's something, again, that is so important. And we need to go back and we need to fix WEP GPO and make sure that everybody who lives in the United States has access to health care.
Couldn't agree more, Steve. All right, Steve, we're going to come back to you in just a few minutes. Thank you for always being such a fierce advocate on so many things, whether it's education, healthcare, veterans' rights, anything we need you for, you're always here for us. And we love and appreciate you so much. All right, Brenda, I want to bring you in. Brenda Rodriguez is our Story Bank organizer. She put this program together tonight, but, Medicare and Medicaid are not just important to the organizing we do at Battleborn Progress, but when Brenda had my favorite, we call him my intern, my favorite child in the world, Aiden. Aiden and her, before they worked here, were on Medicaid. And so, Brenda, I want to bring you in and have you tell your story and honestly, why you do this work every single day and why Medicaid is so important to you and your family.
Yeah, thank you for having me on again, Annette. I was just on a couple of weeks ago, so really excited to be back on. As Annette mentioned, a couple of years ago when I was, like 2 years ago when I was pregnant with my son, I had to be on Medicaid, but because I am on DACA, I don't qualify for Medicaid, so I could only get emergency Medicaid. So that's kind of what I had to go through. I was a part of a program who helped me out with like prenatal visits and helping me set up the whole Medicaid thing because I didn't know anything. I didn't know how to enroll. So they were really great. I can honestly say that if I did not have Medicaid, I would be stuck with a huge bill for my delivery. I was looking at anywhere upwards of $20,000 just to deliver my son, since I didn't have any big complications. But, when you're trying to have this moment that you're trying to enjoy and not be super stressed out, and then you're starting to think about all the bills that start piling up. Prenatal care is also not cheap. So you might have to find a program like I did who can help you out in navigating the whole healthcare system. That's just kind of, a sad reality, kind of like Steve said. It's, something that we shouldn't have to go through, something we shouldn't have to stress about. But yeah, Medicaid for me was a lifesaver. I know I have a friend who got stuck with, I think, like a $30,000 bill for her daughter because, she had a couple of complications. She had to stay at the hospital longer. And so I don't think it's fair that anybody who is going to the hospital for any type of emergency should be getting stuck with a bill that high. Because let's be realistic, again, like Steve said, how is the average person going to afford that, right? So I wouldn't know what to do with anything, even over $5,000 sometimes seems scary. For some people, even anything over $1,000 is just too much, honestly.
So, Brenda, obviously you and Aiden have insurance now, but Aiden was on Medicaid too once he was born. And once he was, he had medical bills, needed checkups, all of the things that babies require once they're born. So tell us how that helped you and helped Aiden when he was so small, navigate the medical system and make sure he was a healthy baby before he had insurance.
Yeah, very thankful that he has insurance now. But it was really hard and difficult again because I wasn't really sure how to navigate Medicaid or anything really with healthcare, with the healthcare system. So I was able to get help in enrolling my son to get Medicaid, but it was extremely helpful because Aiden, my son, ended up having jaundice when he was born. So we kept having to take him in for his regular checkups a little bit more than usual. And I think like the first 2 weeks we had to go at least every other day. So they were really, the bills would have really racked up really fast. We had to pay every now and then, like maybe like $10, $20, but it wasn't anything extreme. I know that if we would have continued to have been uninsured, I really don't know what I would have done with that much medical debt. And it's scary to think that honestly, anybody in this country is living with that much medical debt that they're like, I'll be done with it once I die, basically, because they're never going to be able to pay off that much medical debt.
Absolutely. Brenda, I know this is sometimes hard for you to talk about, but explain to the viewers why, as somebody who has DACA, and maybe explain what DACA is for maybe folks who don't know, why you weren't eligible for Medicaid and how many people who have DACA are struggling with that in our country right now.
Yeah, definitely. So DACA was a program that was set up. I don't want to get the year wrong. So it's been a while.
It was under the Obama administration.
Yeah, definitely under the Obama administration. I don't want to get the year wrong, but for children who were brought to this country by their parents. And essentially it was just kind of protection for us that was put in place. And, it's something that we do have to renew every 2 years. And, one day, hopefully we'll be able to work for a pathway to citizenship. But yeah, in the scope of things, people who are on DACA are not eligible to apply for Medicaid because what they told me was that you have to be a citizen to be able to be on Medicaid. So that's why my son can have Medicaid. And that's why I could only have emergency Medicaid. So emergency Medicaid, obviously, like for when you just go to the hospital to deliver any other emergency situation at hand. You can't just use it for a regular doctor checkup. So, you have to have your own private insurance, or as a lot of people in this country, just be uninsured and, hope for the best, because to be honest, when you don't have insurance, you don't really want to go to the hospital because, again, you don't want to be stuck with thousands of dollars of bills.
So Brenda, had you not had that emergency Medicaid during your pregnancy because of DACA, because of so many other circumstances, what other options would you have had for healthcare, if any?
I don't think I would have had any other options, honestly. Like I said, the great help that I was getting was through a program that I just so happened to stumble upon. But without insurance, I'm sure I would have been stuck paying all those medical bills until my son was probably an adult.
So as you're out here, talking to storytellers like Steve, talking to storytellers like Mary, who I know is watching at home, and so many of our other amazing storytellers that we have at Battleborn Progress that you have brought into our network. What are you hearing about their medical journeys? And what are you hearing from folks about Medicare and Medicaid that they rely on every single day? Why is this anniversary so important?
It's just really important because it's just helped out just countless of people. I know in Nevada alone, there's upwards of 800,000 adults and children on obviously Medicare and Medicaid. But it's just something that the community needs because, like I said, we have Steve here, we have myself, we have Paula, who's going to talk a little bit next. But if these programs weren't put in place, where would we be at right now? People aren't really thinking about, the average person. We're not Elon Musk, who can just give up $20,000 like it's nothing. So when I talk to storytellers, this is really important to them because like Steve said earlier, a lot of people would be dead without them. If you all haven't got the chance to check out the interview that Congresswoman Titus and two of our storytellers did on KNPR, we can look for it and drop it in the chat. But that was a really great example of why storytellers need just a better healthcare system here, because nobody should be paying hundreds of dollars just for one prescription.
Yeah, and Brenda, before we move to Paula, I just want you to talk about the anniversary event you did on Monday, also with Congresswoman Titus, because we were celebrating the anniversary. We're celebrating the birthday of Medicare and Medicaid, which is what this show is about. So talk about that press conference we did on Monday. That was awesome that you put together with our storyteller, Mary, and a storyteller from SEIU. And we'll put the link for the presser in the chat so y'all can watch it at home again if you want.
Yeah. So like Annette said, we did a virtual press conference with Congresswoman Titus, our very own storyteller, Mary Duncan. So Mary, if you're watching, shout out to you for being amazing, like always. And Yarleni Roa Dugan from SEIU, who is a labor and delivery nurse. So we really just wanted to have different perspectives from different community members to talk about why Medicare and Medicaid are so important to them. So if you all haven't had a chance to check out that video, I would highly suggest that you do. That way you can just kind of really get a feel from another storyteller as well on why these issues are really important to us.
Yes. And Mary says hi, Brenda. I see it in the chat. So big shout out to Mary at home, but we will put the link for the story that Brenda worked on back in March with Congresswoman Titus and one of our storytellers named Jamie. And we will also put the link for the celebration press conference that we did on Monday with Congresswoman Titus. So we'll put that all in the chat and take a look. Brenda, we will come back to you in just a minute. I want to move to Paula, our operations manager here at Battleborn Progress. Paula, come on in. Tell us your story with these programs and tell us how it personally impacted your family as you went through a tragedy.
Yes, thank you for having me. I know, we know that these programs, they help people, get their medication. They help people get medical care. But in my experience, it's also so incredibly beneficial to the people's families. My dad was diagnosed with kidney failure back in, I was a young teenager. I was still in high school. And he had dialysis, and then he was lucky enough to be able to get a kidney transplant. But that also required him to be on medication for the rest of his life. So Medicare allowed him, while he was supporting his family, his relatively young family, because I have two sisters, and that allowed him to be able to get the medicine he needs and not have to make those difficult choices of, what we're going to eat, how he's going to provide. And like I said, he finally was able to get that kidney transplant. A transplant is usually best case scenario, good for about 10 years. We were super fortunate. We had my dad 12 years longer. And then he had complications. And even then, he was in the hospital for several days. And then he passed. Now, had he not been on Medicare and had those services, those would have been burdens on, me and my family. At that time, I was 25. It really would have been a burden on me. By then, I was, his primary person that was picking up his medication, helping him with whatever I could. And had he not had that coverage, I don't know what I would have done. I was working, I was going to school. There's no way I could have taken on that debt. Not to mention, he had set some money aside, for funeral expenses and stuff, but those are incredibly expensive things too. So it's something that it is life and death, not only to the person who's on it, but also to the people that love them and take care of them and are going to be there after they're gone.
Absolutely. And thank you for sharing your story. We appreciate that. And thank you for what you did for your dad. why would you say that programs like Medicare and Medicaid are beneficial to communities, and especially communities of color? We were just talking about Brenda's situation with DACA, but we know so many communities rely on these programs to live their lives. And like you said, it's not just the people themselves, it's their families too. It's their children, it's their babies. Why do these programs make a difference, and why do we have to fight so hard to continue to protect them into the future?
Yeah, exactly. I mean, so that's like one ripple, right? So there's the person that's on Medicaid, and then the family, that's the ripple. But then that ripple expands even further into those communities. So if you have all these communities that are being impacted by being uninsured, having high medical costs, it becomes very difficult for them to lean on each other, for them to help each other out. One of the great things is when people are able to share information. So, a positive ripple effect, I guess, is, being informed, having these services, and then being able to share those with, your community, your families, and making sure that people know that this is a service that they could take advantage of. And it's something that can make a huge difference from your day to day. What are you going to eat today? How are you going to pay those bills? How are you going to take care of yourself, and so on?
Absolutely. And just a reminder for those of you who are watching on Facebook, Twitter, Twitch, YouTube, share this with your friends and family on social media right now. Now's a great time to share this out. We also want you to put questions for all of our storytellers and all of the panelists tonight in the chat. So put your questions in the chat. There are no dumb questions when it comes to healthcare. So please, if you don't understand something or you want to learn more, especially about the reconciliation bill that's coming up and how it relates to Medicare and Medicaid and this important anniversary, put it in the chat below and we will get to it in just a few minutes. Paula, I want to stick with you for a few more minutes. You're Latina. 35% of the Hispanic community are enrolled in Medicaid. How can we do more to inform the Latino community about benefits of Medicaid, especially those who only speak Spanish?
Yes, thank you. I think the one really amazing thing is that we're celebrating 57 years of this, of Medicare and Medicaid. And during that time, they've made all this information for a long time available in Spanish. So I do have a link that was super easy to find. It's a government link. I just shared it in the chat, and it has all the information anyone needs in Spanish. Those are government. It's a government site. So the best thing we can do is share it with people, make sure that they're informed, especially in our communities. And make sure that people are seeking these resources and not be encumbered by the fact that they think it's in English, because all of it's available in Spanish.
Absolutely. Thank you for that, Paula, and thank you for sharing your story. Will, I want to come back to you for a few minutes. We've got a lot of questions coming in the chat, and so we'll get to those in a few minutes, and some from earlier in the show as well. But how many people, just to kind of bring this all together, because there's some other stuff in this reconciliation package that people are talking a lot about, inflation, things like that. How many people will benefit from the forthcoming Inflation Reduction Act? Because I know that's also a big part of the conversation right now nationally. Well,
in reality, every single person in the United States will benefit from the Inflation Reduction Act, whether it's something we're talking about drug pricing, and the fact that we're critically now going to get to a point where we're going to finally allow Medicare to negotiate for drug prices, and the effects that will have on the prices people pay who aren't enrolled in Medicare, because what Medicare pays is such a benchmark for so many other plans and programs. I would say, though, that keep in mind that this goes beyond that. So when you look at some of the tax provisions that are in there, that are going to try to make our tax system a bit more fair. That's certainly going to have a positive impact on people, trying to do things that are going to help combat climate change. Those are going to benefit everybody. It's kind of like when we were dealing with the bipartisan infrastructure bill, and we talked about how it's a healthcare bill. Not only is it good for your health to not have bridges collapse when you're driving across them, but also through expanded broadband and what that's going to do to allow more people to participate in telehealth, right? So the way that these bills are structured, I know so often we talk about this segment of the population or people who are enrolled in this program, but in reality, the Inflation Reduction Act of 2022 will benefit every person drawing breath in the United States.
Thank you for that. Well, I want to get to one more of my questions, and then we'll get to more questions that have been coming in the chat and also some comments as well. So if y'all have those at home, or if you're sharing this link out, now is a great time to do that. One of the most frustrating things, and I have literally been screaming at my TV about what nonsense this commercial is, because, you know, political ads are already up in Nevada and running rampant. So Americans for Prosperity, aka the Koch brothers and their shills for, you know, all things terrible. We're seeing those ads here in Nevada that are basically saying that this package will go back on promises from both President Biden and our own Senator Cortez Masto, who have promised to not raise taxes on individuals making less than $400,000 a year. Will this reconciliation package raise taxes on people making less than $400,000 a year, as the GOP claims? Because I know that's garbage, and I think you're going to say it's garbage as well. But there's a lot of ads claiming a lot of things, and I think we need to clear that up right now.
No, it won't. Right. In fact, the way this legislation is structured, this are going to be applying things like the 15% corporate minimum tax. This is looking at closing carried interest loopholes. So the people who are going to be paying some more tax, let's see, hedge fund managers, private equity, right? This is not 99.9. Nobody's getting the tax increase. Certainly nobody who's going to be who's currently making less than $400,000 per year. It's a bold-faced lie. And one of the things that I think is critically important, because we know who is paying for these ads. The reality, and I mentioned this statistic the last time I was on this show, the pharmaceutical industry could lose $1 trillion in revenue and still be the most profitable industry on the S&P 500. That didn't happen by accident, right? These people are tremendously good and talented at finding ways to make as much money as they can, no matter how many people suffer, whether it's in the Silver State, Washington, D.C., or anywhere in between. And they're going to continue to do whatever they can to continue making trillions of dollars off of hurting people who are in need of help. And that's not going to let up. We're going to see more and more of this. And I think it's also important to point out, I know that today is a celebration, right? 57, not today, but the 30th of July was the 57th anniversary of the passage of Medicare and Medicaid. And while we collectively know and appreciate how vital those programs have been to hundreds of millions of Americans, the reality is they are on the chopping block. They have been under attack since 1965 when they are signed into law, and it is being made more and more clear every single day. And all you have to do is not take my word for it, but go ask Rick Scott, who leads the Republican senatorial campaign apparatus, right? Go ask Ron Johnson, the senator from Wisconsin. These people who want to take funding for programs like Medicare and Medicaid and Social Security and not make them what is called mandatory spending, but rather what makes them discretionary spending. And what this will result in is putting these programs at risk of having their funding cut year after year after year, or in this case of Mr. Scott, calling for a sunsetting of these programs every 5 years and a rehashing and a redebating of these things. Never mind, these are programs that everybody on this call has already paid into. Never mind, these are programs that hundreds of millions of Americans have benefited from, because we have to remember these are nothing more than courtesans for the uber wealthy who fund their campaigns. And until we're not even really talked that much about taxes tonight, but some of the ongoing conversations that are happening about tax, whether it's the corporate tax provisions that are in the Inflation Reduction Act, or it's others programs and ideas, both espoused by President Biden as well as being debated in the Congress right now, that are going to finally level the playing field, where right now you have billionaires who pay nowhere near as much in taxes percentage-wise as every one of us does. And until we level the playing field, not only are we going to have an imbalance in goods and services in this country, but we're also going to be, that's a critical component in the fight to preserve our democracy, because you have billionaires right now who buy people like Ron Johnson, put them into office to do nothing but their bidding and do everything they can to keep their boots on the necks of working class people. And that's not just in his home state of Wisconsin, but in Nevada and every state in this country.
Absolutely. And I see Steve nodding as well. But I think I want to put an even finer point on that. You know, right now in Nevada, like I said, we are seeing these campaign ads every single day. We have an ad going up for Adam Laxalt's Basque Fry. That's nonsense that's happening up in Northern Nevada this weekend, about him being a corporate shill for gas companies too. He's literally his campaign is being funded by gas companies, oil and gas companies, while they are jacking up prices on people, on Americans, on Nevadans. And he is sitting here claiming that somehow these oil and gas companies are not responsible for jacking up the prices, which we know they are. Same thing with these pharmaceutical companies. They are literally funding Adam Laxalt's campaign while he's over here, you know, spreading these nonsensical lies about Catherine Cortez Masto, or the Koch brothers are spreading these lies about Catherine Cortez Masto. Yet he wants to cut things like Medicare and Medicaid because we know he does not support, you know, social services. We know that would be one of the first things he does. He doesn't support a woman's right to choose. He doesn't support abortion. He doesn't support democracy. Half his staff was involved in January 6th. So they're upholding all of these things that you're talking about right now. We cannot elect somebody like that here in Nevada. We can't afford to. People will die.
Agreed, Annette.
I was just opening it up for any of you to express your rage there. So go ahead.
No, I mean, yes, there are villains out there, and I think we've clearly communicated the threat they pose. But I would like to stick just to most of my comments that I've made tonight have been on lifting up the champions you have presently, and it would be a travesty for the people, not only of Nevada, but for the people of the United States, to not have a champion for working class people and working class values like Catherine Cortez Masto in the U.S. Senate. She has a tremendous voice and has used it for good. And I think that, you know, again, I try to do everything I can to make sure people know about all the good that people like Senator Cortez Masto are doing every chance I get. And at the same time, yes, as Annette was just talking about, it's important to talk about when you peel back the shiny varnish of some of these candidates and you get into what their core beliefs are, but more importantly, what the core beliefs of their billionaire funders are. It comes at your expense. It will come at Social Security, gone. Medicare and Medicaid, gone. Having, the drug pricing bonanza continue, in which people have carte blanche access to charge people whatever they want, because a 30-foot yacht's not good enough. I want a 40-foot yacht. Oh, wait, some kids are going to die because they can't afford their medicine. Oh, well, I don't have to worry about that when I'm sitting out, on Lake Tahoe.
Well, I want to move to a couple of questions. The first question is from Amber. She asked, is there any talk of the child tax credit coming back in the near future? I know so many Nevadans relied on that. I know most of our delegation, minus Mark Amadei, notice a theme here, support the child tax credit and have historically supported the child tax credit. Are there any conversations going on nationally about that?
In the Inflation Reduction Act of 2022, no. It does not have the support of all 50 Democrats in the Senate. Therefore, it's not going to be part of the reconciliation package that was put forth toward the parliamentarian and will be debated in the coming days. That does not mean that the conversation around the child tax credit is by any means over, right? There was a time in which the conversation we're having about drug pricing wouldn't have had all 50 Democratic votes in the U.S. Senate. That only comes as a result of going back to what we were talking about at the top of the hour, the stories, the communication, and the tremendous hard work, resulting in sore hands and sore feet and cold hands that has occurred due when people are, going to town halls and showing up at events and talking to their neighbors.
Well, I think this comment is so important. Rachel in the and we hear stories like this all the time, and just talk about why these types of stories are so important to the work you're doing right now. Rachel in the comments says, my son was diagnosed with multiple mental illnesses back in 2018. Medicaid has been a lifesaver in covering multiple hospital stays and monthly medications. And, Brenda, as she's doing this work, we hear stories like this all the time from people that these programs are literally saving people's lives. Why is it so important to do these next steps in the reconciliation bill for folks like Rachel's son?
Annette, that's such a great question. So often we talk about these programs, they were signed into law and hey, they're done, right? On to the next. In reality, we have to always, one, be defending them, but also finding ways to expand them and make them better, right? Like one of the things we talk about, you talk about Medicaid, right? Let's finish the job of the Affordable Care Act and close the Medicaid coverage gap and ensure that everybody in this country, no matter what state they live in, have the access to the programs that you were just being discussed. Make sure that we continue to make Medicare better by doing things like we talked about, allowing Medicare to negotiate the prices of certain drugs, and continuing to build on these programs to make healthcare more equitable in this country, and make sure it's something that isn't somebody checking a box, but it's a real resource for people. We don't want a situation where we have people who are, functionally uninsured. They have an insurance, but they can't afford, the tens of thousands of dollars of deductibles that come along with it. So then where do you see? You go to GoFundMe. I don't care where you all live in America. You can go on to GoFundMe and you can find somebody who has insurance right now, but who simultaneously can't afford their very, very high deductible. And that's why we have to continually find ways to improve the existing programs we have, to make them better, to make them stronger, and to make them more equitable for people around this country.
Absolutely. Well, thank you for that, Will. I appreciate you.
Annette, thank you for everything you and your awesome team are always doing.
Yeah, well, we're going to keep holding at least our Nevada delegation's feet to the fire, even our friendly ones. We want to make sure that we get this over the finish line. So we're going to call on them to do that. Brenda, I want to bring you back in. I know Rachel is already one of our fabulous storytellers. We've got a bunch of storytellers on tonight. So thank you all for joining us. But for those of you watching at home, if you want to join our story bank, we're always looking for storytellers, not just on Medicare, Medicaid, and healthcare. We're looking for people who have abortion stories, who have voting rights stories, who have climate justice stories. And Brenda's the one doing that work. So Brenda, come on, tell folks what to do. And also tell us about your Story Bank event you have coming up this month and what we're going to be focused on.
Yeah, so shout out to Rachel for watching today and interacting in the chat. Hi, Rachel. You can actually join our story bank by contacting me directly through my email, it'll be dropped down in the chat below. It's brodriguez@battlebornprogress.org, or you can also just go to our website and fill out the Join Us page, which will also be dropped down in the link below. And that way I can just honestly email you, call you, whatever works best for you. And that way we can just kind of discuss your story, what's going on, and then, the next steps that we can take to further amplify your story, whether that's writing a letter to the editor, being on a virtual press conference like Mary was, being on Out in Front, just like Steve is today and has been a couple of other times. We're always looking for new storytellers, like Annette mentioned. It doesn't really matter what issue you are facing. We also just want to help community members as best as we can. So, if you're not ready to join the Story Bank just yet or share your story, but you do need help, I will gladly help out as well. And we are hosting our monthly storyteller event. I almost forgot the second question. We are hosting our monthly storyteller event August 24th. It's going to be a Wednesday. at 5 p.m. And I will make sure to get the link to RSVP in the chat down below so that you all can RSVP. And if you don't RSVP, I will call you and harass you until you RSVP.
Brenda, what's the topic since it's back to school? Talk to us.
Oh, yes. We're going to be talking back to school with NSEA. So big shout out to them. We're going to have Chris Daly on, who is amazing. I don't know if he's watching today, but if he is, shout out to Chris. But yeah, so join us for a great back to school episode. I know a lot of kids are going back to school. You know, if you have kids and they are going back to school, I'm a little jealous, but, you know, congrats to you.
Brenda's ready for Aiden to go to school, my intern. All right, Brenda. So yes, join us for the Story Bank event on August 24th. It's going to be great. We're also going to be talking about NSEA's Time for 20 campaign to get our educators better funded and better paid because they deserve so much more in Nevada. So join us for that. It's going to be an important topic. We're also going to be doing a lot more on healthcare later this month. Brenda's got some amazing stuff going on with Senator Rosen's team this month. So we'll have more information coming up on that. So big shout out to Brenda for putting this program together and all of the good work she does. And please join our Story Bank. We need your voices. We need you to make your voice heard on all of these critical issues that we have the privilege to work on every single day. So make sure you reach out to Brenda and join the Story Bank. I want to say thank you to Will for staying with us. I know it's late back in DC. Thank you, Will, for all of your hard work on the reconciliation bill. Please call your senator, call our Congress member or congressional members, call Mark Amodei and give him the business and make sure that they support this reconciliation bill as we move forward. I want to thank Steve for always supporting our work. He's such a fierce advocate and we love him dearly. And of course, Paula, our operations manager, for sharing her incredible story with us. And I want to say thank you to all of you for always joining us live at 5 every Thursday. Just a reminder, we will not have Out in Front next week because our entire team is going to Mexico. I wish we were going to Mexico, but we are going to New Mexico for our all staff retreat with all of the Progress Now affiliates from around the country. So we're going to go hang out with our Progress Now family next week, and then we'll be back the following week with Out in Front on our back to school special. So you're going to want to join us for that. So you're going to miss us next week, but we will be back the following week with our back to school special. So thank you all for always supporting our work. Keep wearing those masks because COVID is still a real thing. And we want to make sure that we see you in 2 weeks. So join us in 2 weeks and we will see you after we are back from New Mexico. Thanks so much, everyone, and have a great evening. Call your senators and call your congressional members on this bill. Thanks again.